Hello medical students, so this is Dr. Sid here, and today we are going to talk about empyema. Now it is going to be a very basic topic. We are just trying to focus on the basic features that you can talk about and you can find out. So empyema, the basic definition is pus in pleural space, and this pus is always due to an infection, whether it is an infection in the lungs or it is an infection in the mediastinum that has spread into the pleural space. Now the general characteristics of empyema is pus, like I said, within pleural space, or it could occur as a complication. Like if a patient has bacterial pneumonia, it will he or she will develop pus, or it could be an infection that is spread into pleural space, like mediastinitis, abscesses, etc., etc. The clinical features of this disease depends on the underlying disease. Pneumonia would be the most common clinical feature. So if your professor asks you what is the most common sign you can see in a patient with empyema, you can see pneumonia. The diagnosis for empyema is X-ray or CT scan. The treatment is the treatment is divided into two components. First is to relieve the patient from the pus in pleural space, and for that you're going to do a drainage of the pleura with the process called thoracentesis. And to fight an infection, if there is a pus in empyema, there is an infection, so you will give them antibiotics. Now I have a basic diagram here to show you what's happening here. This is our lungs and this is our lung cavity, and there is a pleural space. Usually it is not a hollow space, but these markings are showing that there is a pus creating a hollow space. It usually is spread here and creates more complications for the patient. And this is the empyema. Now the quick recap: empyema, pus in pleural space, always due to an infection, usually a complication of an infection like bacterial pneumonia, mediastinitis, abscesses. The clinical feature depends on the underlying disease. Pneumonia is the most common. Diagnosis you can done with chest X-ray, CT scan. Treatment: drainage of the pus and antibiotics. This is all for the empyema.